So you're breathing in for 4 seconds and you're breathing out for 6 seconds. So you're breathing in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6. So continue doing that. So breathing in for about 4 seconds and breathing out for 6 seconds. So you're breathing through your nose, but your breathing is silent. And as you breathe in, your ribs are gently moving out. And as you breathe out, your ribs are gently moving in. So as you breathe in, your ribs are gently moving out. And as you breathe out, your ribs are gently moving in. So as you're breathing in, your ribs are gently moving out. And as you breathe out, your ribs are gently moving in. As you breathe in, your ribs gently move out. And as you breathe out, your ribs are gently moving in. Now, this exercise is different to what we did earlier on. So I don't want to, I'll try not to confuse you. So earlier on, I kind of break them into these words here. Breathe light. This is when I had you breathe less air. So you were breathing less air. You were under breathing. And you knew that you were doing this when you felt air hunger. And of course, air hunger is signifying that carbon dioxide is increased in the blood. And this helps to dilate your blood vessels. So it helps to open up your blood vessels. It also helps to stimulate the vagus nerve. So you can increase blood flow to the brain and increase blood flow to the heart, but also you're increasing oxygen delivery. It's a wonderful exercise. And with this, don't time it. Just take a soft breath in through your nose and a really relaxed and slow, gentle breath out. And don't worry about whether you are breathing high or low. Soft breath in and a relaxed and slow, gentle breath out. And it's a wonderful exercise. If you want to down-regulate before sleep, practice 10 to 15 minutes before sleep. But it would be also useful as a meditation. You're in a relaxed environment. So this is what I do before I do public presentations. Now, I didn't do it today, but I've got a training tomorrow and they're full days of trainings with large groups of people. And I will self-regulate before I go out and talk because I want to put the critical mind aside. And the way I do it is I want to down-regulate first. So I want to activate the rest and digest first. And I use this. I do 10, 15 minutes, and especially if I'm jet lagged. I bring my attention inwards, close my eyes, tension onto the breath, really soft breath in through the nose, and a relaxed and slow, gentle breath out. And by doing this, my body is telling the brain that everything is okay. And I'm not going to be overthinking. Because you can imagine a lot of people who are going out to do a public event, they become so wound up and they're overthinking. And it's almost as if the situation has scared the life out of them. Because if they are breathing faster and harder and irregular prior to giving the talk, it's putting them into that fight or flight response. And that's why so many people in the past, they used to use a paper bag because they were hyperventilating. They were losing too much carbon dioxide. There was reduced blood flow to go into the brain, reduced oxygen going to the brain. So it comes back to that well-known paper back in 1988, that the brain, by regulating breathing, regulates its own excitability. Can we influence our own brain cell excitability by changing the breath? And the answer is yes, carbon dioxide. So carbon dioxide, by breathing light and breathing soft and slow, you increase CO2 in the lungs and blood, and this increases blood flow to the brain, and this is a calming effect. But also, if you can't do breathing exercise, say, for instance, some of the people we work with are quite stressed. They can't do exercises, breathing, so they can't do any breathing exercise. So I say, go for a walk with your mouth closed. It's a breathing exercise. Once you do it with your mouth closed, do your yoga with your mouth closed. Once you do it with your mouth closed, do relaxation. You'll find the relaxation free anyway. It's in our app. Have your mouth closed during sleep. That's the key, because there is a huge association between depression and poor sleep. And oftentimes, sometimes we have to think about the Western healthcare model. They've divided the human being into 1,000 different pieces. And the ear, nose, and throat doctor is concentrating on the ear, nose, and throat. The pulmonologist is concentrating on the lungs, even though the lungs and the nose and the throat are all interconnected. But they've divided that into. The eye doctor is looking at the eyes. The foot doctor is looking at the foot. So everybody is all of these things. But it's mental health and sleep are really tied together. So if you know somebody with depression, ask them about their sleep. What is their sleep quality like? Is there a link between sleep apnea and depression? Massive link. Is there a link between PTSD and sleep apnea? Yes, there is. Now, it's not known what causes what, but the fact that there is a link there, and you'll find quite a few papers on this, going back the last 40 years. So depression, sleep apnea, and psychosocial, they are major associated comorbidities. OSA is a rapidly growing problem in society. It's connected to the rising rates of obesity. It is true, once we put on a bit of weight, it does increase our risk of sleep apnea. And at the same time, depression is also increasing day by day. Patients with obstructive sleep apnea present with sleep problems, anxiety, and depression. So imagine you have somebody with depression that's going to their doctor and psychiatrist, but they don't just have depression, they also have obstructive sleep apnea, and their sleep quality is lousy, and that's going to be contributing to their mental health deterioration. So the question that we have to ask ourselves is, can patients with obstructive sleep apnea have a higher prevalence of depression than in the general population? So the question here is, can we really get to the root cause of anxiety and depression if we are overlooking breathing and sleep? We have to look at sleep and we have to look at breathing. In terms of panic disorder, think of the person who is having the panic attack and the brown paper bag. Well, why not teach the person with the panic disorder to breathe light, to breathe slow, to breathe low, but you have to go gently with them, because the air hunger that they might feel during the exercise might trigger them into a little bit of panic. So whenever I work, and I've worked with a lot of people, between 2010 and 2013, I had 3,000 people alone with anxiety and panic disorder that I worked with one-to-one, small groups, and face-to-face. So I wasn't just talking, this isn't just breathing from a theoretical point of view. This is 21 years of experience and making plenty of mistakes. And I've put people into panic attacks. So now when I work with somebody with anxiety and panic disorder, we go so gentle, so easy. I start off with a small exercise that we did today. That's why, somebody with panic disorder, start them off with this exercise. Breathe in through the nose, breathe out, and hold the nose for 5, 4, 3, 2, 1. Let go and breathe in through the nose. And you're breathing normal then for about 10 to 15 seconds. And then again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 5, 4, 3, 2, 1. Let go, breathe in through your nose, and breathe normal for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 5, 4, 3, 2, 1. Let go and breathe in through your nose and breathe normal for 10 to 15 seconds. What's happening when you're holding your breath? It's increasing blood flow to the brain. And carbon dioxide is also vagotropic. So when you think of carbon dioxide as this waste gas, it's nothing could be further from the truth. That's why I asked you to experience it. You know, when you did the breath hold earlier on, did you feel that your nose was opening up? When you do small breath holds, when you breathe light, do you notice if there's any activation of a rest and digest response? So the evidence-based role of hypercapnia, which is higher CO2, and the exhalation phase in vagus nerve stimulation, insights into hypercapnic yoga breathing exercises. Now, this isn't yoga breathing at all. This is just breathing. So it's carbon dioxide, blood CO2 concentration has an enhanced effect on the cardio inhibitory response of the vagus nerve during exhalation. So CO2. So coming back to panic disorder, how should the person with panic disorder breathe? How do they breathe normally? Not when they're having a panic attack. You see them. The person with panic disorder comes in. They are already breathing a bit faster. They have a respiratory rate that may be over 14 or 15 or even 16 breaths per minute. They're more likely to be breathing upper chest. They're feeling they're not getting enough air in their normal everyday breathing. They have irregular breathing. They're sighing frequently. They have their mouth open during sleep. And all of those things are then feeding into their panic symptoms. Their everyday breathing is not good. And then they have a difficult situation and it pushes them over the edge. So breathing, you know, so oftentimes people feel that breathing is all about yoga breathing, but you know, yoga breathing changed in the 1880s. And I've just completed writing a book with a yoga instructor, and the book will be out in about 2 months' time. But I asked a PhD scholar on yoga breathing to write the conclusion of the book. So her PhD is this here, it's called Yoga Breath. And when she looked at the history of breathing in yoga changed in around the 1880s, and they changed due to the hygienic movement. People were dying with tuberculosis. And the idea took hold that, well, in order to prevent or to help the body, then you need to be taking these full big breaths. So the idea started in Europe and went back to India. Before that, breathing in yoga was about light breathing and subtle breathing. So let's just do 5 more minutes of it, and then I'll open the floor to 20 minutes of questions. So why do I like light breathing the most? Because it's so powerful. Can you imagine a breathing technique that even if you practice it for 2 to 3 minutes, you can activate the rest and digest response, and you can improve your blood circulation? And the other reason that I like to show it is because all of the nonsense out there about breathing. Take a deep breath for yourself. You're stressed. What does a deep breath mean? This is a deep breath. A deep breath simply means that you have lateral expansion and contraction. So my diaphragm is there. That's my chest. This is my abdomen. So my diaphragm separates my chest from the abdomen. So it's shaped like an umbrella. I can kind of feel it a little bit if I was to go in there a little bit. Yeah, it's not always the most pleasant thing to do, but you can kind of feel it there. So a deep breath is lateral expansion and contraction of the lower ribs. As I breathe in, my ribs move out. As I breathe out, my ribs move in. As I breathe in, my ribs move out. As I breathe out, my lower ribs move in. Is there a connection between the diaphragm and the emotions? Yes. So it is true to take a deep breath, but what is a deep breath? So we want light breathing. We want slow breathing. We want deep breathing. So one way to remember it is LSD. So those of you who had wild teenage years, you'll probably remember it pretty easily. L is for light, S is for slow, and D is for deep. There are 3 different dimensions, but each of them has a different effect. Light breathing, improve blood flow, improve oxygen delivery. Change your breathing pattern on a regular basis, activating the rest and digest response, strengthening the barrel reflex, bringing the body and mind into balance. Slow breathing, improves alveolar ventilation, better gas exchange taking place. Slow breathing is also helping the body and mind to come into balance. Low breathing, you have the use of the diaphragm massaging all of the internal organs, increased blood flow back to the heart. You've got people with gastrointestinal issues. Your diaphragm there is massaging all of the internal organs with every breath you're taking during the day. Your diaphragm breathing muscle is also connected with the upper airway dilator muscles in the throat. We don't want our throat collapsing during sleep, but yet up to 50% of people, their throat collapses. So the diaphragm is also connected with the emotions. The diaphragm breathing muscle provides stabilization of the spine. People with lower back pain have dysfunctional breathing, 50% of them. Is it lower back pain which causes dysfunctional breathing, or is it dysfunctional breathing which is feeding into lower back pain? People who are sick have poor breathing. Is it their sickness which is causing poor breathing, or is it their poor breathing which is driving them into an increased sympathetic drive, which is feeding back into the sickness? And I wrote that in the book, The Breathing Cure. I looked at people with diabetes, people with chronic health problems, and look at their breathing patterns. And they were in this increased stress response. And then we have to ask the question, are we really going to get ourselves better? Are we going to make some recovery? I'm not saying a cure, but I'm saying some recovery. Can we help ourselves if we're in this constant stress response? If we have poor sleep and poor breathing, we're not going to help ourselves. So let's do 2 minutes of light breathing. So for those of you who joined later, 50,000 miles of blood flow in the body, blood vessels in the body, 50,000 miles. Can we open them up by doing the opposite to what people normally say? Don't take the big breath. Don't take the full breath. And you hear in the yoga class and everybody's hearing their breathing. Oh, wonderful. We are full big breath. What's that doing to your blood circulation? Constricting it when you breathe too much air. So instead, take a soft, gentle breath in through your nose and a really relaxed and a slow and a gentle breath out.